Have you ever noticed that a walk around the neighborhood just feels harder than it used to? Or maybe your legs start to ache and feel heavy, but the second you sit down, poof, the relief is almost instant. Well, if that sounds even a little bit familiar, you are in exactly the right place. Today, we're going to break down what is going on with that frustrating pattern.
And it really does start small. 1 minute you're fine, and the next, a simple trip to the grocery store means you're leaning on that shopping cart just to get through the aisles. Or maybe you catch yourself planning your day around how far you'll have to walk from the car. It's not just about some random ache, it's about what it starts to mean for your independence.
So let's get right to the heart of it. Why this super specific pattern? Why would walking make your legs feel so weak or heavy, while sitting down makes it all go away, just like that? It's not a coincidence. It's actually a huge clue, and it's pointing directly to what's happening inside your lower back.
All right, let's talk about recognizing the signs of this familiar and, let's be honest, frustrating walk. The good news here is that this pattern, it has a name. It has a clear explanation, and understanding it is your first step on the road to relief. A road that for most people does not involve surgery. Okay, so let's dive deep. To really get why you're having these symptoms, we need to take a look inside your spinal canal and see what's actually happening in your back. We're going to explore what spinal stenosis really is. I want you to think of your spinal canal as a bony tunnel. Its whole job is to protect the really important nerves that travel from your spine all the way down into your legs. So, lumbar spinal stenosis, it simply means that this tunnel has started to get a little bit narrow. And when that happens, the nerves get squeezed or compressed, which reduces their blood flow and kicks off that feeling of heaviness, numbness, or pain in your legs.
So what's causing this narrowing? Well, it's almost never one single thing. It's usually a combination of totally normal age-related changes that happen over many, many years. For instance, your spinal discs might lose a little height. The little joints in your back can get some arthritis. There's a specific ligament in there that can get thicker, and your body might even form some tiny bone spurs. Each one of these things, as you can see, can slowly start to crowd that tunnel, leaving less and less room for your nerves.
And now we get to my favorite part, what we call the shopping cart clue. This explains everything about why walking hurts and sitting helps. This pattern is probably the biggest clue we have for diagnosing stenosis, and it all boils down to your posture.
Check this out. It's all about mechanics. When you stand up straight or walk, your lower back naturally arches just a little bit. That simple movement actually narrows the spinal canal and puts a squeeze on those nerves. But when you sit down or lean forward, your spine flexes the other way. This opens that canal right back up and takes the pressure off. That's why the relief feels so immediate.
This whole classic pattern actually has a medical name. It's called neurogenic claudication. It sounds complicated, but it's really just the official term for that leg discomfort, that heaviness or weakness that gets triggered by walking and goes away when you sit. It's considered the absolute hallmark sign of lumbar spinal stenosis.
And here's a fantastic insight from Dr. Kamal that just nails it. The shopping cart sign, as we call it, is incredibly telling. When you lean on that cart, you're forcing your spine into that forward flex position, which opens up the canal and lets you walk farther with less pain. It's such a simple, everyday thing, but it tells a specialist a ton about what's going on.
Now, one thing that gets people really confused is the difference between stenosis and sciatica. So let's clear this up. With stenosis, you're usually feeling an ache or heaviness that gets worse with walking and better with sitting. Sciatica, on the other hand, is often that sharp electric zinging pain, and it can actually get worse when you sit. They're totally different problems with almost opposite triggers.
Okay, so let's talk about the path to relief. The whole goal of any treatment is to take that pressure off the nerves and get you moving comfortably again. And for the vast majority of people, this journey starts with conservative, non-surgical care.
A modern philosophy is all about preserving your natural movement. It follows a really logical set of steps, always starting with the least invasive options. So step 1 is almost always physical therapy. Then we look at simple activity modifications. If that's not enough, targeted injections can help a lot. Surgery is only ever considered if these other steps don't give you the relief you need.
So what in the world does activity modification mean? It's not about stopping everything you love to do, it's just about being smarter about how you do it. Simple things, like planning to take a sitting break during a long walk, or choosing a recumbent bike at the gym because it naturally keeps your spine in that open, flex position. Honestly, even just leaning forward a tiny bit when you walk can make a huge difference in how far you can go.
Now, for some people, conservative care just doesn't quite cut it, and it's not enough to get their independence back. In those cases, it's time to talk about surgery. But it's so important to know that modern spine surgery has come a long, long way.
When surgery is the right call, the goal is simple: decompression. We're just creating more space for those nerves. And compared to old-school open surgery, a minimally invasive approach uses a much smaller incision, it spares the healthy muscle around the spine, and you often get to go home the very same day. That all adds up to a faster recovery with way fewer complications.
Okay, now listen up, because this is a really crucial point. Decompression surgery for stenosis does not automatically mean a fusion. This is one of the biggest fears people have. A fusion surgery is only needed if the spine is unstable. For the vast majority of stenosis cases, the goal is simply to decompress, to remove the bit of tissue that's pinching the nerves. And that's it.
So with all of this information, you're probably wondering, okay, when is the right time to actually see a specialist about this? How do you know when it's time to pick up the phone and make that call?
You know, the answer really isn't about a number on a pain scale. It's about how your symptoms are impacting your life. If you notice that your walking distance is getting shorter and shorter, if you're actively planning your life around how far you have to walk, or if you just feel like your legs are getting weak or unsteady, that's a good time to have a conversation. It's all about your quality of life. Now, while most stenosis symptoms come on very gradually, there are a few red flags that mean you need to seek care right away. Any sudden or really rapidly worsening weakness in your legs, any loss of bowel or bladder control, or numbness in the groin area, those are signs of a rare but serious issue that needs to be checked out in an emergency setting.
And this final thought from Dr. Woods just perfectly captures the whole philosophy of good spine care. An MRI, yeah, it can show us the anatomy, it can show us the narrowing, but it's your story, how far you can walk and how this has changed your life, that tells us what really truly matters. We don't treat images, we treat people.
So if you've been living with the uncertainty of these kinds of symptoms, maybe the most important question you can ask yourself is this one. What could you possibly gain just from getting some clarity? A single conversation to really understand your options might just be the first step to getting your mobility and your independence back.